Private equity is buying up medical practices. Find out why on Medical Economics.
I think first and foremost, it's capital for growth. To function these days, practices need technology. They need to hire new doctors. They need to open new offices. So private equity brings capital. They also bring know-how. They're business managers who've been successful, and doctors are great clinicians, and some are great business people. But having that professional business partner is very useful.
Private equity investors have turned their attention on a lucrative sector of the U.S. economy, healthcare. The trend of equity firms acquiring healthcare providers isn't new, but it has accelerated in recent years. U.S. private equity deals in healthcare have doubled in the last decade. In 2018, there were nearly 800 deals, a record number, worth more than $100 billion. That trend has continued in 2019 and shows no signs of slowing down. What does private equity investment mean for the healthcare system, and specifically for physicians? Today, we are pleased to be joined by attorney Rick Zall to talk about private equity's impact on healthcare and what it means for physicians. What does private equity mean?
Private equity is capital that's coming in the private markets as compared to public equity in the stock market. So it's investment capital contributed sometimes by pension funds, sometimes by private individuals, and it's pooled together and managed by investment professionals.
Why have private equity firms targeted healthcare?
Healthcare's been an interest because it's big. First of all, the sector, as you know, is close to 20% of the GDP. It's also growing really fast, which private equity likes. It's important. It's recession-proof by and large. So it's a sector that has attracted a lot of attention.
In general, what are investors looking for when they are considering a purchase of a hospital or a health system?
Well, they're looking for a good business. So a business that can be run profitably, that has good management, and has good growth prospects. So it's really similar to what a private equity investor would look at in any industry, but just focused on someone who's succeeding in the healthcare industry.
So from the perspective of a practice, how are the acquisition goals of a private equity firm different than a hospital or health system? So what are some of the differences there?
Well, a private physician practice tends to be smaller, run by physicians, usually with a business manager, and very specialized. A hospital, whether it's for-profit or not-for-profit, and many are not-for-profit, are more bureaucratic organizations. They're more traditional. So I think a physician practice is more like a family business than, say, a hospital.
And does the management, so if a private equity firm is coming in seeking to purchase a practice or a group practice, whatever format, are they seeking different things than a hospital coming in to purchase a practice? How is that different?
Sure. So again, most of the private equity in the medical practice area involve investments with the physicians in, say, a management company that they have formed. They need the physicians to continue to practice. So it's not a buyout where they're replacing the business executives. It's a partnership with the physicians. A hospital, needs doctors to operate and to bring patients to the hospital. So that's one where the hospital is really looking for the physicians to fit into their objectives, as opposed to private equity with a physician practice. It's investing in the physician's practice.
What are the potential benefits of a practice being acquired by a private equity firm?
I think first and foremost, it's capital for growth. To function these days, practices need technology. They need to hire new doctors. They need to open new offices. So private equity brings capital. They also bring know-how. They're business managers who've been successful, and doctors are great clinicians, and some are great business people. But having that professional business partner is very useful.
Are there any potential drawbacks, or maybe drawbacks is the wrong word, any potential challenges that physicians need to consider before a private equity acquisition?
I think it really boils down to having a partner. So there's some loss of control over decision making, but I think that for those who pick the right private equity partner, it's having someone who can help the business be successful, even if you don't have absolute control.
So one of the trends in healthcare right now is sort of the growth of value-based care, and I'm just wondering how value-based care and private equity sort of mesh together. Has the growth of value-based care sort of increased sort of this trend of private equity acquisitions in healthcare? I'm kind of curious about that relationship between the two.
Sure. I think it has, because the challenges of operating in a value-based payment environment are far greater. It's not just about seeing patients, dropping a bill, and getting paid. It's about delivering value. What the payers are looking for are outcomes. And I think private equity brings some more sophistication to a practice. And I think with the right physician practice, the physicians control the patient population and can perform better in a value-based environment. Physicians are more important for a value-based environment.
In terms of primary care, what value does primary care hold for private equity? It's my understanding that the earlier trend has been specialty care has really been an interest to private equity, but is that correct? I guess I'm wondering what the value is of primary care to private equity.
So you're right that private equity has done a lot in the specialty areas, orthopedics, ophthalmology, dermatology, but primary care physicians are really the managers of care. They're the air traffic controllers. So in a value-based environment, they are important because the patients will be going to them first and they'll coordinate care.
There has been some critiques in the mainstream media about private equity and sort of what happens to businesses after a private equity acquisition. And I'm just wondering what your take is on that, and also, if it applies to healthcare in any way.
There have been some stories, but I think that those are the exceptions, not the rule. I think most private equity is interested in partnering and growing businesses. And if a physician practice picked the right partner, I think that those examples are not going to be seen.
So there's obviously been a surge in the number of acquisitions in recent years. And I'm just wondering what you think about the trend in the near future. Do you think the acquisitions in private equity will continue? Do you think it'll level off? What's sort of your crystal ball in the next few years?
I think it will continue, at least in the short term. Valuations are very high, and there's been speculation that perhaps they would come down. They really haven't. So I think for at least the next couple of years, the environment is very fragmented. I think there'll be more acquisitions. Perhaps 3 to 5 years out, it will be reduced.